morning, everyone. Welcome to the AIDS Focus Conference and welcome to Ben. I'm absolutely thrilled that we have a conference today on key populations. I'm really pleased that we're all together today, and I hope that we're all here with the same feeling that judgment is not something that we're interested in. What we're interested in is making everything safe for everyone, and in order that everyone can realise their sexual and reproductive health rights.
So I think looking at the last 15 years of the response, we've seen tremendous advances, and we've seen a growth in experience, in political commitment, in the mobilization of civil society and community activism. But the gap between those achievements and ending the epidemic is still too wide. People are still being left behind.
We've just come to the end of our AIDS Focus conference today. We started with a presentation from Sally Smith from UNAIDS on fast-tracking the AIDS response for key populations. And then Anthony Waldhausen from the Gay and Lesbian Network in South Africa presented on HIV and AIDS care, prevention and treatment for lesbian, gay, bisexual, transgender and intersex populations. So he was looking at addressing stigma and victimization that people encounter.
It's been very successful. I mean, to the fact that we even have the police coming to us and asking us, please, can you run these sort of trainings for us, because they need it, because they do not understand what is LGBTI is. And the whole focus of this training is to create an awareness, is to create, to challenge the participants' homophobias, myths about homosexuality, and we are proactive in the sense that we do not debate the issue, we dialogue with them, and we very inclusively share the stories, and at these workshops.
And then we had a presentation by Laurent Guetta from the University Hospitals in Geneva, who presented on syphilis, HIV and other sexually transmitted infections in a female prison in Bolivia.
And our recommendation is to implement preventive campaigns, education, provision of condoms, and program of screening and treatment of syphilis and other STDs. And now, with our association, in this prison we implemented the diagnostic of syphilis to everybody at entrance.
Luciano Ruggia of the Federal Office of Public Health presented on sexual health among sub-Saharan migrants in Switzerland. And there he presented on the study on sexual behaviour among African migrants. And this provided points for action in addressing some of the needs and some of the vulnerabilities of this population in Switzerland. And then we had a format called Bar Talk, where I interviewed Claude Nkanga of the Fondation Profa on the sexual service needs of migrants to Switzerland. After lunch, we had a presentation from Muriel Sack-Seng, who works with Handicap International, and she presented on the access needs and the special needs of persons living with disabilities who get left behind from the prevention and care programs.
1 billion people in the world is living with disability. Negative attitudes of health workers towards people with disabilities. So often we hear testimonies of women going to seek care, and a nurse or doctor would say, but how did you get pregnant? How did I get pregnant like anyone else? But this is the questions that they get when they want to get services for antenatal care or even HIV prevention. Why do you want HIV prevention and testing? Like assuming that they would not have sex, but they do have sex like anyone else.
Martin Leschorn then conducted some group work on what we as the AIDS Focus platform can do to increase the awareness of the needs of vulnerable groups within international cooperation. And finally, we had a panel discussion on what is possible to achieve and how to achieve it in terms of the ambitious goals that we've set for ending the AIDS epidemic by 2030, and what can be done on the international level. And Sally Smith from UNAIDS presented this perspective. We also looked from the perspective of the Swiss government, and Susanne Amsler presented the perspective of SDC. And also Anthony Waldhausen from the Gay and Lesbian Network and Muriel Maxeng presented on Handicap International from the NGO perspective of what can be done and what's needed.
Just to flag some of the pieces, countries need to determine how they're going to take these global targets and apply them then at their own country level. And that will be about accelerating the implementation of prevention and treatment services. It'll be about implementing programs that are effective to reach 90% of the populations at higher risk. So that will mean stopping doing some of the things that are not effective, as we said before. It'll mean making sure that we reach the key populations, particularly people who inject drugs, sex workers and transgender populations. And part of that will be to scale up community-based service delivery and to work much more effectively with community groups to do that. And I think Laurent raised, it was Anton who raised an interesting point this morning, that as civil society groups and community groups take more of the services out into the community, they have the reach to those population groups. They know who they are, where they are, and how to reach them in the best ways. But at the same time, how do we make sure in doing that we don't undermine the responsibility of government to reach all their citizens with services? And it's a very fine balance. How do you make it a national response where the civil society is contributing and it's not only a government implemented response but a national coordinated response? And I think the other piece there is when you see increasing amounts of government funds going to civil society to provide some of these services, then do you cut off the ability of those civil society groups to be the advocate? Do you cut off the hand that feeds you as you're taking more resources from a national budget? Because at the moment, much of the resourcing for key populations work is coming from international sources.
So, and I would like to thank you for the whole day. It was really nice. And I hope you will stay a little bit longer. We will have an apéro now. And for those who need to go home, have a safe trip home and see you soon again.